is going to be soaked up by the gauze there. That's okay.
Yeah.
If you didn't bleed after I put a needle in your foot, then I'd worry, actually.
Yeah.
So, why isn't he bleeding?
Oh, look at that.
Yeah, up we go. We're going to use something the equivalent of a rubber band around the base of your toe, and it'll seem a little snug, but it won't hurt you at all. I only use this with the phenol procedures or with the matrixectomy procedures. If we were just removing the edge of the nail and doing nothing more, I wouldn't bother using this.
That's why you get little tiny tinglies like it's asleep.
Yeah. So, again, normal, and it should feel pretty fuzzy in all the areas that I'm
Yeah.
touching. All right. A few other things here.
Is this the type of thing that you're hoping to someday do?
No. I'm actually an endocrinologist, so we deal with diabetes and
Okay.
foot issues. So.
A little bit of overlap between the endocrinology clinic and a lot of the diabetic patients that they see, and then with certain foot problems that come in here, but we're just spending kind of a full day of looking at foot problems of all sorts.
Excellent.
Change of pace compared to what you normally do.
Yes,
there.
that's right.
So instrumentation, I have kind of a set pack for doing these procedures.
Okay.
It's called a freer, and it's not sharp.
Mm-hmm.
You heard it all. But there is a slightly more pointed end on one versus the other. This is a little duller.
Yeah.
Between the two ends, use the one that's a little finer, and you'll have more, if you do these procedures, you'll have more control of how you're doing the work. And just relax your foot as best you can.
All right.
Since we're just targeting the one side, we're going to use it in this direction to just gently kind of separate between that proximal nail fold and the skin here. About the width of the freer is all you need to do, so we're not going to disrupt the rest of this. And then you turn it so concave side up, and then you're just going to go about the width of the freer along that border. So you may feel a little pressure here. You doing okay?
Yeah, it's interesting.
Yeah.
I imagine if you didn't numb it up, I'd be shrieking.
You wouldn't like me very much, no. So you're going all the way down to that underside there. So you find out how well your block worked pretty much by now,
Okay.
and the patient will tell you loud and clear. This is called an English nail cutter, and the English part is important, but the blade on the bottom is fairly dull. This is the cutting edge here. So what you're doing is you're using that flat bottomed area to actually go beneath the nail plate so as to not damage the nail bed or the skin beneath the nail as much, or less likely.
Right.
All you're doing is just removing a few millimeters of nail here, not a big chunk, but enough to get the job done so that he's going to get a predictable outcome. Let's take it all the way down to that corner there. Again, a little video footage here.
Yeah.
Excellent. All right. We'll expect it on YouTube. It's called a splitter, and again, not sharp enough to where it's going to cut you, but if you're not sure whether you made it all the way down to the corner here, you can just use it to finish it at the base there.
So it's officially split off from the rest of it now?
Yeah, so we've isolated the part that we need to address. And then, standard hemostat, what you're going to do is just grab as far down towards the corner without grabbing the skin. And the maneuver that you want to do is you always want to rotate towards the midline of the nail when removing these. So, just going to do this. And out it comes.
That's going to be something interesting to watch later.
Yeah. And a lot of this is not nail, it's just redundant skin that is as a result of that irritation in there. Not grossing you out too much? You doing all right?
Yeah, it's a little yucky, but
Yeah, a little yucky. But, you know. There we go. So I just wanted that little spicule out of the way, so it's not going to block the medication as it goes in there. Good. So the reason for the rubber band or the tourniquet, if you will, is so it doesn't bleed too much. And up to now, it wouldn't really make a difference if it was a drop of blood or two. But with the phenol, the bleeding would neutralize the effect of the acid.
Oh.
So now we just go ahead and apply it right in that corner there. And you can see there's 4 Q-tips total. And it's about 30 seconds a Q-tip. That's the magic formula. So, can't tell anybody. And the rest of it's a piece of cake. We'll be done in 2 minutes here.
The acid doesn't have any weird effect on the skin, huh?
Well, I try to control the area of where I apply it, and this sort of tapered Q-tips, it's not your standard Q-tip that you clean your ears out with, so it's tapered, so it's just going to be in that nail groove where it's going to be having its effect there. If it happens to spill over, I tend to try to soak up some of the redundancy there.
I'm amazed at how quick of a procedure it really is.
Yeah, it doesn't take terribly long. Usually I can try to get it all in an initial visit. If I'm running behind, sometimes people have to come back. But I seem to be on time today. Can't say
Actually, watching it, I don't know if I'd want to come back, even though it doesn't hurt. The simple idea of
getting this kind of poked and prodded. So in between the third and fourth applications of this phenol, we'll use a kind of a dermal rasp, kind of this is irritating. You can see a sort of ridge through here.
Right.
And what you want to do, again, thank goodness for local anesthetic, you just want to kind of get in there and rough it up a little bit. Get that last little piece of tissue out. You go from the top side as well as the bottom here. So you want to play hardball so that this does not produce nail again. And then last one, and we're in good shape. So the skin will meet the new edge of the nail, but the new edge is now, like I said, more flat topped. With the time frame that you want, the alcohol neutralizes it. And we let the cuff down, or the tourniquet down essentially here. It'll ooze a little bit, but it's not going to make a mess. All right, so antibiotic of choice. We've got just a couple of squares of gauze. apply it, you only need one square, you won't need two. You just simply lay it over the top, nothing crazy. And they do sell similar products in the pharmacy, so if you want to stop by, you can pick up something that will serve the same purpose, essentially, to mummify the toe. They may not have pink, though. This may be flesh colored only.
I'll search.
Search, all right. Any questions at all?
Oh.
You did well. All right.